Hello everyone. Today we are going to study about Clostridium perfringens pathogenesis. I have in my previous videos put lectures on Clostridium morphology, classification, biochemical reactions, toxins. So today we are going to study about the pathogenesis, and those who are interested in knowing other things about Clostridium perfringens can go back to my previous videos and find it out. So let's start with pathogenesis. Clostridium perfringens causes gas gangrene, that is synonymous to clostridial myonecrosis also. As you can say, myo is muscles. So necrosis in muscles is what gas gangrene is. We are going to study this in detail in the next few slides. Then it also causes enteritis, that is also called enterocolitis, then enterotoxemia. So enteritis and enterotoxemia I will be taking in the next lecture. Here we will be focusing on gas gangrene. My view is that I put small videos so that you can revise and be perfect in the topics that should be clear to you. So small videos I'm putting on each topic so that you enjoy and you remember that also. Coming back to gas gangrene or clostridial myonecrosis, this is caused mostly by Clostridium species, that can be Clostridium septicum, Clostridium novi, Clostridium sporogens. But basically, most common species that causes is Clostridium perfringens. Yeah, it cause what is the gas gangrene? It is a severe injury that goes deep into the body, basically deeper muscles and tissues. And what happens in this case is the bacteria gather in an injury or surgical wound where the blood supply is cut off, so that this is an anaerobic bacteria, so it goes on multiplying, and then these wounds which are deeper are tougher to clean also. So completely, when wounds are not clean, this bacteria can happily multiply in it. Going to the next slide. I have already told the pathogenic or virulent factors of Clostridium perfringens, in which I've talked about all the kind of toxins that are present in Clostridium perfringens. So here in this Clostridium perfringens, what is the role of alpha toxin? This alpha toxin inserts into the plasma membrane of different cells like blood cells, blood vessels, muscle tissue, and triggers platelet aggregation, thrombosis, and histamine release. All this platelet aggregation, thrombosis, and release of histamines will produce gaps in the membrane, cell membrane, and thus disrupt the normal cellular function. And this aggregation and thrombosis, release of histamine, to leads to normal disturbance in the cell function. And one more thing happens, that is the some degradative products are also released, since the cell membrane of the muscle cell is also destroyed. So from the skeleton muscles, the degradative products are released, and these also disturbs the cells, and it causes hypoxic or ischemia, that is the increase in the oxygen supply. And when the increase in the oxygen supply, all blood cells are getting affected, blood vessels are getting affected. So what it will lead to? It will lead to low level of oxygens, and this low level of oxygens, in this bacteria is very happy because this is an anaerobic bacteria and it gets the chance to multiply. And when it is multiplying, it is becoming, its toxins are highly lethal. It is causing necrotizing infection with the production of gas. Gas is also produced while this bacteria multiplies. So this causes extensive tissue damage where it is multiplying and leading to profound shock and even death. So what are the symptoms in this case? It's painful swellings as the gas is inside it. So skin turns pale to brownish and it's filled with brown fluid too. air under the skin is because the air is present under the skin, so skin gets swollen, and if you are going to touch that part of the skin, you can hear the air inside it. Edges of the infected area too keeps on growing in minutes. It's very quick. It's the wound grows in size. That means the skin air is the portion wherever the cells, wherever the skin is touching, that's keeping on growing. It also leads to fever, chills, pain, and less superficial inflammation at the site of infection. So inflammation will not be that visible, but the gas will be going around, and that wound is discharging foul smelling brown, red, or a kind of fluid, and increased heart rate can be observed. Vesicle formation, which combines into a large blisters, can be seen, and it also gives all over yellow color to the skin, that is jaundice. So here I have put on some pictures, images that you can see. Here the see the wound that is deep inside the tissues, and these are the symptoms you can see on the top. That is the foul smelling discharge that is that is discharged from the fluid filled wounds, and surface and subcutaneous discoloration also happens, and it goes into deeper, and this can finally first it affects the muscle tissues, and then finally it can also affect to different organs, thus leading to death too. How can you perform lab diagnosis or tests? What tests had to be done? You have to take bacterial culture stain. You have to collect the specimen and then perform staining, that is gram staining, and Clostridium perfringens is gram positive bacteria. You can also perform the culture and see the culture morphology and match it. I have given a whole lecture on what media this can be cultured. You can go back to my previous video and see. So those cultures are needed. Imaging can also be done, like X-ray, CT scan, or MRI of the area, and you can see the gas bubbles or changes in the muscle or tissue while performing these images. Biopsy can also be done, and you can look for the damages or changes in the tissue structure. What are the treatments? Treatments is debridement, that is you can remove dead or damaged tissue, and can send it for this debridement can be done before the lab diagnosis, so that the gas does not keep on moving and bacteria multiplies quickly, and thus infecting going around all towards the body. So you can give antibiotics, that is the combination of penicillin and clindamycin. In some cases where the whole thing has necrotized, you have to perform amputation, and you can also give hyperbaric oxygen therapy, that is 100% rich oxygen can be given. Since it's an anaerobic bacteria, it will stop multiplying. So there is a difference when I was teaching streptococcal group A streptococcal infections. In that I talked about necrotizing fasciitis. So this is also causing damage. So necrotizing fasciitis is also leading to necrotizing of the tissues, but the basic difference between the necrotizing fasciitis is that it necrotizes the fats under the skin and the connective tissue, while this gas gangrene necrotizes usually the skeleton muscles, muscle structure, blood vessels, and blood cells. So this is all which I have wanted to talk to you about the Clostridium perfringens pathogenesis, and that too only gas gangrene. In the next slides, in the next lecture, we will talk about the other two pathogenesis of Clostridium perfringens. Thank you so much.